Hi, welcome to our pathology NEET sessions. We are discussing about the disease of bone. In this video, we are going to discuss a small topic but very important topic, that is your Paget's disease. Okay, Paget's disease. Paget's disease of bone. The Paget's disease of bone, it is also called as your osteitis deformans. Okay, the osteitis deformans. The osteitis deformans is called Paget's disease. It is actually an abnormal resorption and abnormal deposition of bone. So we are seeing here there is an abnormal bone remodeling. Okay, so it's actually an abnormal bone remodeling. That means that there is excessive resorption of bone. The bone is resorbed excessively, and it is deposited back in an abnormal way. So, and there is an abnormal deposition. So what happens when there is an excessive resorption and abnormal deposition? We are getting a bone which is abnormal and archic. Means the bone formed itself is of low quality and it is deposited in a different structural pattern. The architecture of the bone is also that way anarchic. Okay, anarchic deposition of the bone, and that is called pagetic bone. Okay, pagetic bone, or it is called brittle. It is very brittle. The bone. Okay, the bone is very brittle. Okay, that is called your pagetic bone. Now, the reason for this Paget's disease, there's a gene mutation which is seen in the Paget's disease, which is very important. That is your sequestrome gene, sequestrosome, sequestrosome gene. That is SQSTM1. Okay, sequestrosome gene. That is the gene which is mutated in the Paget's disease. And now there is a question which was previously asked in your NEET examination. There is a virus which can be combined, or virus which can be supposed to be a reason for Paget's disease. It is not proven. The virus, which is a controversy still, virus related to the Paget's disease. Okay, and that is nothing but your measles virus. Okay, measles virus, that is the virus which is related to the your Paget's disease. Now, what is the function of the sequestrome? The sequestrome will activate osteoclast. Okay, the sequestrome that is controlling your osteoclast. That's why we have a excessive resorption there. Okay, now you should know the sequestrosome XQSTM1 gene that will activate your osteoclast. Now, what happens when they activate the osteoclast? There is excessive bone resorption. Okay, and there is an abnormal deposition. Okay, abnormal deposition. So this is what happened in the Paget's disease. Now come to the clinical features. What you can see in the clinical features of Paget's disease, very important. It usually affects the males and than females, but it usually affects the age above 40. So that is a very striking point. They give you a clue that a man presenting with the so and so condition, a man with age above 40, a man at an age of 50. Okay, so the age of the patient who show Paget's disease is usually above 40. It is seen in the old age males. Okay, that's what we are going to prove here. And the most common bone which they can affect is the maxilla and then the mandible. And what you are seeing in the clinical feature is that there is a uniform enlargement of the bone, uniform symmetric enlargement of bone. Okay, this is what you are going to see. So in the face, the malar bone and the mandible, the maxilla, everything is getting symmetrically enlarged. That enlarged bone is in the face is giving an appearance of a lion. Okay, that is called leontiasis ossea. Leontiasis ossea. Leontiasis ossea is that it means that the bone in the malar bone, the maxilla and the mandibles, okay, they are getting enlarged. Okay, enlarged, and it is giving an appearance of a lion-like face. Lion-like phase. Okay, it is also seen in fibrous dysplasia, but it is more specific in the Paget's. Okay, so Landiasis osseosa can be also seen in fibrous dysplasia, but it is more specific in the Paget's disease. Now, other things you can see is that the bone is formed will be weaker bone. Okay, weak femur bone. Okay, or weak bones in the extremities. So what happens where they can't bear the weight of the body? They can't bear the weight of the body, so there is bowing deformation. Bowing deformation means that they will bend the femur or the leg bones. Okay, the tibia, fibula, all these bones cannot bear the weight of the body and they are of low quality. There is bowing deformation, that is called a simian-like stance. Simian-like stance, like, or we say monkey-like stance, just like a monkey is standing. Okay, monkey-like stance. All these can be seen. Other thing you can see is that the base of the skull base of the skull become flat. Okay, it become flat. It's called a platybasia. Okay, platybasia can be seen. Now, if you see the radiograph of this patient, okay, what you can see is that there is lot of lytic lesions, and that is having a mixed radiolucent radiopaque appearance. Okay, lesions. There is mixed radiolucent radiopaque appearance. At that condition in the skull where you see mixed radiolucent radiopaque appearance, there's a characteristic radiographic feature for Paget's disease that is known as cotton wool appearance. Okay, the cotton wool appearance. That is a peculiar feature of this here Paget's disease. The other thing is that there is in Paget's disease there is generalized hypercementosis. Hypercementosis. So this is also the hypercementosis is also a striking feature. These are all very important question areas in your Paget's disease. Okay, so Paget's disease you are seeing a lot of lytic bone lesions along with the mixed radiolucent radiopaque appearance in the jaw, and that mixed radiolucent radiopaque appearance is called your cotton wool appearance, and you are seeing generalized hypercementosis in the jaw. You are seeing multiple lytic lesions in the jaw, loose tooth, etc. All these are seen. If you see the histopathology of the Pagetic bone, you can see that abnormal bone is deposited. Okay, in a zigzag or haphazard pattern. Okay, abnormal bone is deposited in a haphazard pattern, and that pattern is called your jigsaw pattern. Jigsaw pattern. And there's a presence of reversal line. What are the reversal lines? The reversal lines are the line which demarcate the newly formed bone from the old bone. Okay, so these reversal lines are broken reversal lines in Paget's disease, that is known as BRCA lines. Okay. BRCA, BRCA lines are seen. This is about the histopathology. Now coming to the lab diagnosis. What's about the lab diagnosis? It is very much important area in the your Paget's disease lab diagnosis. First thing you are seeing that there is an elevated serum alkaline phosphatase. Okay, elevated serum alkaline phosphatase. In your fibrous dysplasia, in your cherubism, all these cases, the serum alkaline phosphatase, the serum calcium, serum phosphorus were normal level. But in Paget's disease, we are seeing a increased serum alkaline phosphatase, but your serum calcium and your serum phosphorus, they are all normal. Okay. So only the serum alkaline phosphatase is in a very high quantity. There is greater than 250 Bodansky unit. Okay. And another study you can do is the scintigraphy. Scintigraphy is a method where you are using radioisotopes which will bind to the Pagetic bone, and we are taking an X-ray. Okay, so we are using bone scan. bone scan. Okay, and in the bone scan in scintigraphy you are getting a special sign called a Lincoln Beard sign. Lincoln Beard sign or black beard sign or Lincoln beard sign is seen in the scintigraphy of patients with the your Paget's disease, because when you apply this radioisotopes and you took a bone scan, this radioisotopes will all bind to the Pagetic bone in the mandible, and if you take a radiograph you can see that this is appearing as a beard of the patient. Okay, that is called bone scan or scintigraphy, and it shows a Lincoln beard sign. And other things you can see that there's an increased urine hydroxyproline and the urine values are high. There is an increased urine n-telopeptide, n-telopeptide, and there is an increased urine uh, c-telopeptide. Okay. So all these can be tested in urine, which is showing there is an increased bone resorption, and these two are more specific, more specific. Okay, so these are all about your Paget's disease, and treatment of Paget's disease. There is no much treatment you can give. Bisphosphonates. Bisphosphonate can be given to block this activity of this osteoclast. So that's all about your Paget's disease. It's a short video of Paget's disease which I was trying to cover the most common questions they ask in the NEET competitive examination. Each word is a point for your NEET competitive examinations. Okay, hope you have understood Paget's disease. See you in the next video. Thank you.